Hello, everyone. I'm Semra Aitor, and I'm an epidemiologist and an associate professor in the Department of Health Management and Policy at UNH. And thank you for inviting me to speak with you about climate change and public health. I'm hoping that this presentation will be informative for you, and we'll try to keep it relatively brief, even though there's a lot to cover here. I apologize, I'm going to keep my screen in this mode rather than full screen because it was getting stuck on me during an earlier presentation and I need to be able to advance my slides by clicking on them. So apologies for the lack of a full screen presentation, but we'll do the best we can here. So I want to emphasize a few key points that I would like to make for takeaways for this presentation. I'm going to be talking about the public health impacts of climate change in New Hampshire, and much of this work is drawn from a report that I published with colleagues, Dr. Cameron Wake and Dr. John Bucci in 2014, and you can access the report at the link below, which I'd encourage you to do if you have interest, especially in particular details about any of the topics that I'll be introducing today, since I will really have to kind of skim the surface and hit the high notes. But this report does include a lot of details about the methodology, and it goes into more depth on each of the public health impacts that I'll be introducing to you today. I'm also going to talk about how vulnerable populations may be differentially impacted. And I'm going to identify some intersections between climate change and the SARS-CoV-2 or COVID-19 pandemic, since I think often these are not talked about in an integrated manner in the media, and there's some really important connections that we should think about recognizing here. And I'll try to use maps and prior research, especially toward the end of the presentation, to illustrate these impacts. I also have provided a lot of references throughout, so you're welcome to refer to any of these research studies on your own for further detail, or just email me, I can share with you. So to kick us off here, I'm going to start with perhaps the most important message, which is climate change is impacting public health now, and will continue to do so probably even more severely in the future. So these are important concepts because those of us working in public health have known that climate change has been impacting people for quite some time now. This isn't a future thing any longer. And I know that decision makers must balance multiple needs and priorities. I've given similar talks to all the way from mayors up to our congregation in Washington, D.C. So I know that people are juggling a lot. There's a pandemic on. Decision makers have to think about everything from health to the economy to the environment and equity considerations. So there are many, many different things that I know are creating multiple challenges, particularly at this time. The ones that I'm going to discuss in terms of public health impacts that are probably most relevant to New Hampshire are the ones listed here: heat effects, sea level rise, more frequent storms and flooding. And then I will talk a little about vector-borne disease and food and waterborne, just because those are also important, but I won't have time to go into the many, many different health impacts, especially some like wildfires that really aren't as prevalent for us here in the Northeast yet, although they certainly affect other parts of the country. The other thing I wanted to mention here is that these challenges also bring opportunities for us to consider the co-benefits of planning in more sustainable ways, and for really thinking about ways in which some public policy decisions might benefit both people and the environment and the economy. They're not always in opposition to each other. So one of the things we really try to do in public health is start encouraging people to think about co-benefits. So how is climate changing in New Hampshire? Well, New Hampshire has been getting warmer and wetter over the last century. And this is probably the most important message from the report that Dr. Cameron Wake really led in terms of the climate impacts that you're seeing here. We know that the rate of change in terms of temperature, for example, rising temperature has increased over the last 4 decades. Since 1970, for example, the annual maximum temperature has warmed from 0.5 to 2.6 degrees, and the greatest warming occurs in the fall or winter. The number of days with minimum temperatures less than 32 degrees Fahrenheit has decreased, and the coldest winter nights have warmed. Annual precipitation has increased by 7 to 20%, and extreme precipitation events really have increased across the region. We've probably seen, if not witnessed ourselves, the large flooding events that have impacted our coastal communities in New Hampshire. And I do have some research that I conducted with colleagues that is referenced more specifically to the Hampton-Seabrook area, where you can really get a much closer and more granular look at what those impacts look like, both from a human health and environmental and economic perspective. So I'd encourage you to look at that, and I'll show you the reference in clearer detail in a moment. But let's kind of talk about a little more what is happening in our climate and health report, where we really did a number of things to generate future climate projections. What our team did is simulated temperature and precipitation from 4 global climate models, which were statistically downscaled using historical weather observations. And there really were 2 emission scenarios that we focused on for this report. Again, Dr. Week's team really led this work, and we accounted for a range of potential fossil fuel use by utilizing these 2 scenarios, which you can, to make it simple, think of as a lower emission scenario and a higher emission scenario. In the lower emission scenario, improvements in energy efficiency were combined with the development of renewable energy to reduce global emissions of heat-trapping gases below 1990 levels by the end of the 21st century. And in the higher emission scenario, fossil fuels are assumed to remain the primary energy source, and emissions of heat-trapping gases grow to approximately 3 times those of emissions in the year 2000 by the end of the century. So those are the parameters of those 2 scenarios, and you'll see them reflected visually in another couple of slides. So just kind of keep those in mind. What we know is the current global emissions trend from 2000 through 2014 suggests that in the absence of concerted efforts to reduce emissions, climate change will likely track or exceed the scenario projected under the higher emission scenario over the course of the century. As heat-trapping gases continue to accumulate in the atmosphere, temperatures will rise in New Hampshire. So let's take a look at what that would look like from a graphical perspective. And in the report, you'll see that we did this with 2 separate graphs, one for northern New Hampshire and one for southern New Hampshire. I'm showing you the northern New Hampshire panel here. And what you can see is that there are increases in temperatures from 1960 in this case, going forward to 2100. And where the emission scenarios really start to depart, with the higher emission scenario depicted in red and the lower emission scenario depicted in blue, is right around the year 2040, maybe a little bit before that. So that's where we can really see, depending on our actions, this potential split in terms of what our temperatures might be going forward to 2100. And the 2 panels on the left, it's showing you the average maximum temperature, on the right, the average minimum. So what does this mean in terms of more of a contextual view? The frequency of extreme heat days is projected to increase dramatically, and the hottest days will be hotter, raising concerns regarding the impact of extreme heat on human health, infrastructure, and the electric grid. As a result of an increase in heat-trapping gases in the atmosphere, temperatures across New Hampshire will continue to rise regardless of whether we follow the high or low emission scenario. However, the magnitude of warming, where you saw that split occur between the red and the blue lines, really can be expected to depend on the emissions pathway that's followed. We can influence how much warmer things do or do not become potentially. And we also looked at precipitation. So average precipitation is projected to increase 14 to 20% by the end of the century compared to the historical average. So you'll see a lot of graphs and statistics about precipitation in the report as well. I just wanted to draw your attention not to the detail here, so no one has to focus on fine print, but if you are interested in putting some actual numbers to the graphs that I just showed, there is a table here, table 1 in our report, which really breaks this into short-term, medium-term, and long-term projections using the low emissions and the high emissions scenario side by side for each of those phases, short, medium, and long. And you can look at either minimum temperature, max temp, extreme temperature days per week. So this will really provide a lot of the detail if you're concerned about this topic that you can refer to directly from our report. What does this mean for public health? Well, the projected increase in the frequency of hot days and associated increases in heat stress will likely lead to more heat injuries and deaths. We know that mortality rates are correlated with the number of days where maximum temperature is greater than 95. And actually, since we did this report in 2014, a really good scientific peer-reviewed paper has come out, which was published by Dr. Kathleen Bush at DHHS and colleagues at Brown University, Dr. Greg Willanius, and other colleagues, where they really showed that actually it's 85 degrees Fahrenheit that is the trigger of concern within the range of concern, and where serious health impacts really can start to accrue with 85 degrees Fahrenheit and higher. Their work is a very detailed and statistically sophisticated account of that, and they have since, I think, been able to work on revising heat warnings in light of those findings. I have cited that later in the presentation, so please try to read that if you're interested in this. It's really, really good work. We also know that death and injury due to extreme weather events can lead to morbidity and mortality associated with flooding, storms, and exposure to contaminants that can be left behind in the wake of storms, for example, mold and other contaminants, where even when the floodwater recedes, these things can remain in homes and dwellings for quite some time. That can exacerbate pre-existing conditions, such as asthma or other pre-existing health conditions people might have. And of course, I think the one thing maybe we are now more conscious of than ever before is that when there is such a disruption in our lives due to the pandemic currently, or it could be a flood or a climate-related disruption, we really find that it can become very, very difficult to obtain the basic things we need to keep ourselves healthy. That might be medications, access to food, access to health services, keeping our homes safe. All of those things, let alone keeping our businesses and our livelihoods afloat, can really be simultaneously impacted. And I think perhaps there's a greater understanding now at the population-wide level of what that can feel like due to the COVID-19 pandemic. We also know that additional indirect health impacts are associated with extreme weather events, and these can include degradation of water quality and increases in emerging diseases, new pathogens, which can also affect contaminated seafood. And we have longstanding issues with things like harmful algal blooms, for example, which can increase with higher water temperatures. And those can have significant public health impacts as well. In Toledo, for example, it actually affected the public water supply due to a harmful algal bloom. There, we have not had that level of impact here, but we do have blooms, as they do in Vermont and in surrounding states. So these things are occurring, and they are things that we need to keep watching and monitoring. So this figure from the IPCC really does a nice job of showing what we call direct and indirect health impacts. And that's just an important concept to convey in a talk about climate change and public health, because both are really very important, both direct and indirect, but often the media attention goes to the direct impacts, which include things like deaths due to a wildfire or direct injuries due to a flood, for example. Maybe some emergencies due to a severe heat event. And those things, no doubt, are very, very important. But we also know that the indirect exposures and the indirect impacts, which can accrue from climate change, can also be much longer lasting, and in some cases actually carry greater greater cost and economic impacts as well. So I have another slide, I think it's this next one here, that again, if you go back to our report and look at table ES3, there's a summary of the potential health impacts, sorry for the missing S there, associated with climate change. And these are, you won't have to read all the fine print here, but what we tried to do to organize this table for you, and there are many more that could even be listed on one page, is we took each climate and health indicator, for example, heat stress, that could be measured by the increase in the number of hot days. For example, we now know hot is 85 or higher. And then we look at primary and secondary health impacts, which kind of mirror the language in the prior slide, which was direct and indirect. So if we think about for heat stress, primary impacts would be increase in heat-related illness and death. We probably see those in hospitalizations or death statistics. But then there are really significant secondary or less direct impacts, which could include increases in cardiovascular impacts. For example, we know that people with underlying cardiovascular disease can have increased symptomatology during a heat event. We also know that violence increases during heat events, and suicide can also increase. And then if we look at the last column, this is the column where we really try to point out some of the equity considerations and the differential vulnerability. So for example, with heat stress, people who live in urban areas with little green space and might experience what we call a heat island effect, where there might be a lot of pavement or impervious surface that really just acts like a convection oven radiating heat, very little green space to buffer that often. And it's really frequently our lower income neighborhoods or communities of color where there isn't enough green space and these heat island effects are clustered. And that temperatures there can sometimes vary by, I've seen as much as 8 to 10 degrees, so it can be significant. The other thing to keep in mind are people who might have jobs that require them to work outside in hot conditions. So for the heat stress indicator, those are the kinds of folks with certain occupations that we would really want to consider in terms of the differential impact of them. So if you kind of, take each one depending on which health indicator you are really interested in, this table will take you through that process of thinking through each one. And again, you can refer to that from the report. So let's talk a little about foodborne illness. Foodborne illness is expected to increase as a result of extreme weather events. With climate change, the CDC estimates that approximately 16% of Americans become ill and 3,000 die of foodborne illness every year. And in New Hampshire, with those increases in temperature and precipitation, what that might mean from a food safety perspective is with increased power outages, that can disrupt refrigeration, there can be more food spoilage, and impacts to fisheries and other food economies associated with pathogenic organisms, for example. The other thing that we've been increasingly conscious about, again, with respect to the COVID-19 pandemic, is there are significant issues with food security, especially in certain parts of our state. Here I'm citing research from Jessica Carson at the Carsey Institute, and there are a number of Carsey reports that you can access to read much more about this issue. We know, for example, that much of northern and western New Hampshire has a higher proportion of lower income residents and low population density, which can result in less access because there are fewer full-service supermarkets and other places where you can buy food. And that's really shown in the map here, where without even reading the fine print, if you just look at the density of the colored dots, which represent different kinds of food service outlets or places to buy food, they're really concentrated in the southern part of the state and can get pretty sparse up in the northern part. So when there are disruptions to our food system, either due to a pandemic or due to climate change, there can be real exacerbation in existing food insecurity. So vector-borne disease, I'm not an expert in vector-borne disease. There are people who specialize in that as their whole career. And so I'm just going to hit the high notes here, but we know that vector-borne disease incidence in New Hampshire has increased in the past decade, and the projected increase in temperature and precipitation may create conditions conducive to further increases over time. The next slide, I think, which has some maps for you, really illustrates that. Sorry, I'm getting the afternoon sun here. So for example, Lyme disease. Here we see the incidence of Lyme disease from 2001 moving forward to 2018. And you can really just look at the dark blue dots and how much more of them there are as you move to 2013 and then pretty much persisting. So increases in Lyme disease is definitely something we've seen in the public health community. And waterborne disease. So waterborne illness caused by microbial organisms may increase as a result of an increase in extreme weather events associated with climate change. This again can be related to both water temperature and precipitation frequency and severity, which can all result in, for example, increases in harmful pathogens, resulting in increased human exposure, for example, cryptosporidium, other types of pathogens. And often people can become exposed to these if they're swimming or immersed in water and they get water up their nose or accidentally down, swallow a little bit. That can be enough to expose them, as well as sometimes, like I mentioned, with the harmful algal blooms, occasionally those can even impact drinking water supplies. They have not in our state, but in Ohio, that was a serious concern. The other one that I really want to mention is the implications for mental health and stress-related disorders. Poor mental health is associated with climate change and severe weather events. And I often refer to this as the hidden shadow or the long shadow of climate-related kinds of impacts, whether those are, for example, from flooding or hurricanes, especially any kind of thing where people are displaced for a longer time from their home. That can really carry very long-term mental health implications. And you know that from Hurricane Katrina, there's been quite a lot of research there showing that as long as 10 years after, significant proportions of the population is still dealing with stress and mental health issues. And of course, then if we think of things like COVID-19 and perhaps the convergence with pandemic events, there is really a very clear need to focus on our mental health systems and our capacity there. So there's a couple of points I want to make again about intersections between climate change and COVID-19. And really there are two key points here. One is that climate change can play a role in increasing our risk of future pandemics. And the reason for that is as on a global level, the planet warms, animals are forced into closer contact with human beings, sharing much of the same space with human beings where they used to be able to be more distanced. And as a result of that, our increases in zoonotic disease, which means spreading from a pathogen, spreading from an animal to a person, as was the case with this virus. And most of the emerging pandemics, we now know at least 2/3 of them are coming from a zoonotic origin. So whenever you have this sort of more permeable membrane between animals and humans, there's going to be increased risk of zoonotic transmission. And many of our current emerging pandemics start that way. Climate change can also play a key role in exacerbating the impact of pandemics. And a recent study out of Harvard, for example, suggests that people who live in places with poor air quality are more likely to die from COVID-19, even when accounting for other factors that may influence death. So again, this really shows that where you live and climate change can differentially affect the built and natural environment of the places where people live, and that can lead to further health disparities, which we've definitely observed with COVID as well. How does climate change affect healthcare costs? Well, we spend just over $3 trillion per year in the United States on healthcare, and research suggests that approximately 50% of those deaths in the United States are potentially preventable, largely by influencing, for example, pollution, diet, exercise, and other lifestyle habits. And there's a study from the EPA that was conducted in 2011 that assessed the return on investment, showing that the benefits, for example, if you look at the costs related to the benefits, they were able to determine that the benefits of the Clean Air Act for every dollar invested, reduce air pollution and give a return on investment of approximately $30. So 30 to 1 is the return on investment there for having clean air. So I think with that, I am going to, I know I'm supposed to keep it short, and you can see that this is a topic where we could talk for a very long time. I just want to show you one more slide, which gets at the local vulnerabilities, in this case from a study that was conducted in the Hampton-Seabrook estuary. And in relation to the map that you're seeing here, what you're seeing are census tracts with their little white census tract numbers. But the takeaway message from this slide is when you look at an area at a much more specific geographic level, in this case, the census tract level, and this is the kind of a snapshot of parts of the towns of Hampton, Seabrook, and Hampton Falls, sort of this area, which is really hard to see what that is. But what we did here is we composed a social vulnerability index based on the CDC and NHDHHS guidelines, and there is documentation for how that's done. It's fairly standard in the literature. And that allows us to color the tracts according to the number of vulnerability indicators they have. So for example, this tract in red had a number of different social vulnerability indicators that paint this particular profile of that tract: 31% living in poverty, 23% having a disability, about 21% are over the age of 65. So all of these clusters of risk are co-occurring in the census tract. And then the ones that are a little more orange have fewer vulnerability flags or indicators. Those are the orange ones. And the ones that are yellow really have 0 or just 1. So those are the lower risk areas. What we did for the flooding study is we overlaid this index with, and that's the real flood example from 2018 in that area. Here's our representation of using really sophisticated hydrology modeling where the future flood impacts would hit the hardest. And so here you can see that, especially as these are projected forward in time using different storm surge scenarios with and without sea level rise. And you can read all about how we did this in our other report, which is the NOAA report led by Dr. Paul Kirshen. That's referenced, I think, on the prior slide or in my references. And you can see the flood goes right through that very highly vulnerable red census tract. So the folks who are least prepared to deal with these impacts are probably going to be among the hardest hit. Those are the kinds of things that we can draw out using, for example, health impact assessment methodologies like we used in this report. Thank you so much for allowing me to share my time with you today. Thank you.
Hello, I'm Justin Cates, Director of Emergency Management for the City of Nashua, New Hampshire. And I've been asked to talk a little bit about adaptation and emergency management. What are some of the things that emergency managers are doing today as a result of increasing storm events, heat waves, and all the other things that we deal with when it comes to climate change? So emergency management, real brief, we typically look at it from 4 phases. Mitigation, which is the reduction of risk, actions that we can take prior to an emergency to try and buy down that risk as much as possible. Preparedness, things like acquiring supplies and training and working plans to ensure that we're prepared for different types of emergencies. Response is what people mostly see when they think of emergency management. As you see on the pictures here, we might activate our emergency operations center to manage emergencies. We might activate shelters, things like that. And then recovery, that's the reconstruction, rebuilding of the community after a disaster, but also trying to get the society, the business community back to as much normal as possible. And all of that is done as part of the emergency management cycle. But one of the challenges that we deal with in emergency management is the activities that we're predominantly involved with throughout the year are only a very small subsection of the types of activities that actually make a difference when it comes to community risk. Here you'll see when we're talking about flood risk, evacuation plans are certainly something emergency management is responsible for. Risk communication to the public and ensuring that they're aware of what the risks are within the community related to flooding are all things that you'll find emergency management heavily involved with. But when it comes to zoning and flood walls and storage of flood water, building codes, those are things that might be found by other departments within the city or in the state. And those are things that emergency managers have to work closely with those stakeholders to ensure that we're looking at emergency management holistically. So what are we concerned about as emergency managers when it comes to climate change? Our primary things that, at least from an inland city, I'm concerned about more extreme rain events, so those rain events that drop lots of water in a short period of time, or more frequently drop lots of water in a short amount of time that our stormwater system is not able to keep up with. More hot days, particularly in our downtown urban core. Those houses in most cases don't have air conditioning, and so there's a lot of concerns related to heat waves and extreme heat days that impact our vulnerable populations. Certainly more wet snow events. We see those during nor'easters, typically in the October, November timeframe, where lots of heavy wet snow will be dropped, and it results in trees down, wires down, and a lot of big problems for emergency managers. And then more dry days. Drought is another concern that we have. In the city of Nashua, we're not as concerned related to the challenges with our water supply because we have two sources, both from the Merrimack River and from the Pennachuck supply ponds. But that is something that's concerning to rural emergency managers where there's a lot of reliance on wells, and that's something that certainly is a concern. But we do have a lot of great data, both at the national level and here within the state, that help to guide emergency managers on the types of actions that they can take. On the left, you'll see the Climate Explorer, which is a helpful tool for emergency managers to understand their risk related to climate change. And then certainly the reports that Dr. Cameron Wake from UNH has put together with his team on the climate impacts here within New Hampshire. So when emergency managers typically look at the impacts of events on critical infrastructure, one of the new things that we're really focusing around is lifelines. These are things that are essential to the community really relies on. And so a significant flood event might have the potential to create impacts to many of these lifelines and the components that are within them. So if we're looking at more frequent rain events that impact these, you're going to see more frequent disruptions to the necessary things that we rely on as a society. So emergency managers typically don't look so much at the hazard, but instead at the impacts and the consequences that occur due to that. So to combat that, one of the things that we did back in 2018 was we implemented a program called the Resilient Nashua Initiative. And this was an effort to update our city's hazard mitigation plan, which is a requirement by FEMA to do every 5 years. And we decided we were going to include climate adaptation and really pre-disaster recovery planning as a part of this, using this 6-step process that the National Institute of Standards and Technology put together. And throughout the process, you'll see on the left and the right-hand side here, there were a number of partners that assisted us through technical assistance and funding to go through something like this. Now, unfortunately, this is a pretty substantial effort. It's probably not likely that every community across New Hampshire would implement a similar program, but there are best practices and things that can be pulled from this and implemented within each jurisdiction across the state. So why did we look at community resilience rather than just the broad hazard mitigation approach when updating this 5-year plan? We thought, well, we're looking much beyond that 5-year planning horizon. What are the impacts that we're going to see, including changes in climate, much further than that 5 years, and what impact is that going to have on the city of Nashua? And we also wanted to look at those chronic long-term stressors rather than just single hazards that might occur, whether they be flooding or a significant storm or a heat wave for a couple of days. What does the long-term impact of a very hot summer have within our community? And one of the big things that came out of this was this concept of the resilience dividend, or also known as co-benefits. When we might implement some sort of an activity within our community, like a transit system, there are multiple benefits that come along with it. So in the emergency management case, it's now an emergency capacity that we can use to evacuate people during a disaster, but it also reduces harmful emissions. It connects people to jobs. So it has a lot of great benefits to the community. And so one of the things as part of the Resilient Nashua Initiative was really ensuring that we would reach out to the whole community and ensure that we had representation and involvement from all of our community organizations, city departments, to make sure that what we were recommending when it came to trying to reduce risk in the community was really accurate and needed by the community. We also had a website that we had put together to crowdsource recommendations and concerns that people saw across the community. So if they saw flooded streets in a certain part of the community, they could post that information on the map, and we'd get a better idea where there were concerns that we had to deal with in the city. As part of the Resilient Nashua Initiative, we did a pretty substantial risk assessment, and we found that a lot of the critical infrastructure that we had talked about, those lifelines, were at risk. And here's our wastewater plant, certainly at risk for flooding. And this is something that's much more concerning to us now, because not only is it at risk for riverine flooding, but in the downtown urban core, where you've got combined sewer systems. So that means those areas where stormwater goes into the general sewer system. In most cases, those aren't designed to deal with significant rain events beyond your normal routine storm. And so when we have these extreme rain events, the systems are overloaded, and in most cases, you start seeing flooding and ponding on roadways, which is, unfortunately, a situation where you've got combined sewage also involved in that. So this is a major concern for emergency managers when we look at consequence management. But it's not just critical infrastructure when we look at the bridges and the important buildings that we have within the city that government owns. We also look at the economy. And so as part of the risk assessment, we looked at flooding and what types of census blocks would see the most significant economic losses during major flood events. And you'll see here, it's obviously around the areas where the rivers are, but there are some really interesting things that you can look at here to see where there are some vulnerable locations due to flooding. And one specific example here is the area off of Daniel Webster Highway in Nashua, where right along the Merrimack River, we have quite a bit of economic drivers within our city and our region as well. So, looking here, you'll find that the Pheasant Lane Mall is within that what we would call the 0.2% recurrence interval flood event, so also known as the 500-year flood event. And this is something that not only has happened in Nashua before, we have seen the 500-year flood event, but it also is a situation where this is likely to happen much more frequently in the future if we start to see more significant rain events. So definitely something that concerned us and concerned our stakeholders when we looked at flooding across the city of Nashua. So as part of the Resilient Nashua Initiative, one of the things that we did was we looked at the infrastructure within the community and identified when we wanted those things back up and running during a crisis. And then in order for us to get those things back up and running, what would need to be done? And what were the expectations of recovery from those critical infrastructure owners? So as an example, here on the left-hand side, you'll see hospitals, fire stations, the police station. And based on a scenario that was run by a software program called HAZUS, it looked at a significant flood event and it identified what would be the functionality of that property after the flood event. So we would then be able to use that to determine on the right-hand side here, we want our public safety facilities open one day after a major flood event. But the software hazard scenario is actually saying that we're not going to have those facilities back open until 4 weeks afterwards. So how do we reduce that gap? By mitigation measures, preparedness, trying to get those facilities back up and running. And as part of our Resilient Nashua Initiative, we had to identify those mitigation actions that our community could take to go and try and reduce that risk. So historically, we've looked at things like, replacing bridges so that they allow more water to flow through, or culverts to allow more water to flow through, hardening our electrical infrastructure. But now there's an approach that we're looking at when it looks at trying to use green infrastructure as a way to reduce hazard risk within a community. And so there's a lot of great resources to use when you're looking at putting together a mitigation plan. And these are things that we might look at within the city as we try to reduce risk. We also use a process called the Resilience Dialogues, where over a period of a month, we worked with academia and subject matter experts from around the country to take lessons learned and best practices from other cities that are the size and style of Nashua, so that we could figure out what works best to try and reduce flood risks or heat risks within the community. There have been things that we have done and implemented within the city to reduce flood risk. One good example, if you've ever been to the Margaritas restaurant in Nashua, you'll know that that's the Jackson Mills Dam there. And one of the things we did a few years ago is we actually essentially cut off the top of that dam in an effort to put inflatable crest gates on the top of it. And what those crest gates allow us to do is actually to lower when there's some sort of a flood event either approaching or is occurring, and we can actually now allow more water to pass through that area without being concerned about flooding upstream. And when we did this, we were actually able to remove a substantial number of properties from the floodplain. And what it did was it ensured that we were able to keep this really critical renewable energy asset online within the city. So we're trying to really do, again, those co-benefits, try and reduce flood risk, but also ensure that we have a renewable energy asset there within the city. Another thing, and this has not been done yet in the city, but it's certainly something that we've been looking at and interested in doing with some of our community nonprofit partners, is a concept called resilience hubs. And the idea here is to implement activities and facilities that can work to support the community during, let's just say, an extreme heat event, with battery charging, air conditioning, other types of services. So that way those that are at risk within the community can go to these locations with their other community members and get the services that they need during these extreme heat events or major storms where there's power outages, those types of things. So this is something that we've been working towards, and the idea here would be to use things like solar plus storage, so battery storage, to keep these facilities online and up and running, regardless of whether the power grid is up at all. And it all comes back to really this fundamental problem. Across the city are challenges that we're not all vulnerable to the same level. The downtown area, there are certainly areas along the river, the Nashua River, that are more vulnerable than others. But then when we look at the demographics within those communities, we know that there are populations that are more at risk for the types of impacts related to disasters. And we need to focus all of our planning efforts for extreme heat events, major storms, and all the services that come along with it to ensure that those populations are served first. It's really essential for us in an emergency management lens to think about how we can provide services to those areas within the downtown or along the riverfront to make sure that they are getting the services that they need. Certainly, you can reach out to me with any questions via email or phone. If you have any questions about what we're doing related to emergency management and climate change here within the city of Nashua. Thank you.
Thank you for inviting me to participate today to discuss climate change, air pollution, and health. I'm an allergy, immunology, and pulmonary medicine physician and an adjunct professor at UNH. So we're going to look at what the data shows from a clinician's perspective. The Department of Defense had a review in 2010 on climate change, and this is what they said. Climate change will contribute to food and water scarcity, will increase the spread of disease, and may spur or exacerbate mass migration. But what is climate change? It's not just global warming. It's the destabilization of the Earth's climate due to altered composition of the atmosphere. In other words, increased concentration of greenhouse gases such as carbon dioxide and methane. And greenhouse gases trap solar radiation, leading to global warming. So the basic aspects of climate change are that greenhouse gases concentration are increasing. Greenhouse gas affects climate system. World average temperature is rising relatively fast over the past 30 to 40 years. Sea level is rising. Many temperature-sensitive systems, including agriculture and farming, have changed over the past 2 decades, secondary to climate change. And an additional change of severe degrees centigrade within coming century will disrupt the foundations of life on Earth. So the key determinants of greenhouse gases are energy production, energy consumption and efficiency, transportation, agriculture and food production, and waste management. So the environmental factors that are linked with climate change include extreme summer events and extreme winter events, all of which we have in New Hampshire, air pollution, forest fires, thunderstorms and floods, allergens, and dampness and mold. And I'm going to concentrate on air pollution and the allergens. So this is a complicated cartoon looking at the effect of greenhouse gases and climate change on the effect of health system and the causes, including even social mediated factors. I'm going to concentrate on cardiovascular and the respiratory diseases, but you can see that there is a complicated interaction that affects other aspects of our health. So the disease of interest that we're going to concentrate on include asthma, allergies and rhinitis, COPD, respiratory infections, and cardiovascular diseases. So there are direct effects, indirect effects, and social dynamics that all play a role in the health impact. The direct effects are things such as storms, droughts, floods, and heat waves. The indirect effects that I'm going to concentrate on are going to be air pollution. And you can see that there is definitely some social dynamics that are quite intricate that interacts with the health effect as well. And we'll be looking at things such as cardiovascular disease, respiratory diseases, and allergies, but mental health, undernutrition, and other causes of health impact are represented in this slide. So the areas of concern to us in the United States include cardiorespiratory health, heat waves, increased pollution, and asthma and allergies. So some of the issues that deal with respiratory health and climate change include biomass burning, windblown dust, and biofuels emissions. So biomass burning includes the burning of wood. New Hampshire has the second highest pollution from wood stoves, second only to Maine. We're not really affected as much by the droughts from Western US, although forest fires do have a large plume of smoke that is affecting areas way beyond California. The biotic system includes long and warmer growing seasons, enhanced pollen production, and specifically we know that CO2 levels being high increase the ragweed pollen, not only the intensity of the pollen, but also the duration of the ragweed season. So I'll first start with air pollution. So epidemiological studies have tended to characterize the effect of air pollution on health into short-term and long-term effects. So short-term effects of air pollution on health in this study, which was in a European study, shows an increase in PM10. Now that's particulate matter 10 microns per cubic meter. And this slide shows that cardiovascular disease and respiratory disease all have an increased percentage of health effects from the air pollution. Another short-term effect study was done by the National Mortality and Morbidity in Air Pollution Study and was reported in the New England Journal of Medicine. And this shows that there is an increase in mortality in all natural causes, but also a significant increased mortality in cardiorespiratory causes again from PM10. In this study that was published in the American Journal of Respiratory and Critical Care Medicine of the American Thoracic Society, showed an increase in admissions for diseases such as asthma, COPD and asthma, and all respiratory conditions in 65 and older, with a PM of 10 and also with black smoke. The long-term effects of air pollution on health. There are 4 studies here showing the association between air pollution and mortality in 6 U.S. cities that was published in the New England Journal of Medicine. A study from the American Review of Respiratory and Critical Care Medicine showed particulate air pollution as a predictor of mortality in adults, and lung cancer, cardiopulmonary mortality, and long-term exposure to fine particulate air pollution, which is PM less than 10 and greater than 2.5 microns, was published in JAMA. And then many studies have been shown to show an association between mortality and also morbidity with exposure to traffic-related air pollution, not just this study in Lancet. The American Cancer Society showed a health impact of pollution as cause of mortality, especially in lung cancer, but also with cardiopulmonary causes. And the Stockholm study showed a myocardial infarction mortality was associated with long-term average air pollution exposure, such as from diesel fuels and overall air pollution of PM10 and PM2.5. The German study showed cardiopulmonary mortality was associated with living within a 50-meter radius of major highways, again, showing the effect of diesel fuel and pollution on health. So in this cartoon, we're looking at air emissions. In the middle part of the cartoon, looking at ozone, PM10, PM2.5, nitrous oxide, sulfuric acid, and benzene, on the exposures in outdoor air quality leading to cardiorespiratory disease, lung cancer, acute respiratory infections, and cardiovascular diseases, including strokes and heart attacks. So this slide shows what happens to asthmatics. It shows an increase in hospitalizations with asthma literally right after the point of exposure to air pollution, actually lasting for 6 days after the exposure before coming back to baseline. This is a study from the Annals of the American Thoracic Society from 2018, looking in New Hampshire at the annual mortality and morbidity and impact days associated with exposures to ozone and PM2.5. And you can see that Rockingham County and Hillsborough County, which has a high population and has more concentration of population in cities, has a higher impact days and also higher mortality and morbidity. So this is a map of the United States showing the annual excess morbidity and mortality from air pollution. You can see in New Hampshire, their annual excess mortality is 15, but you can see in states such as Pennsylvania, Texas, and California, which have much higher population and city densities, there's a much higher cause of mortality and morbidity from air pollution. So what have we learned? Well, the epidemiological observed association between premature death and long-term residence in areas with high air pollution concentration is robust. The deaths are largely due to cardiopulmonary causes. Similar associations have been observed with asthma exacerbations and exacerbations of other respiratory diseases such as COPD. And in many locations, the prevalence of asthma and allergies are rising. And we'll go into that in future slides. Also, the proximity to highways and busy roads with high density of diesel vehicle exposure increases the risk of negative health effects. So now I'm going to discuss the climate effect on allergens. So this is a slide from the Boston area looking at the ragweed pollen associated with different locales, including the city, suburbs, and rural areas. Now, cities are heat islands and increased CO2 and ozone, and you can see that there's a much higher incidence of ragweed concentration and pollinization in those areas compared to the rural areas. This is a slide showing the effect of pollen concentration, namely ragweed pollen, with the exposures to increase in carbon dioxide. And there's a significant increase in the pollen exposure, pollen count, and also the longevity of the pollen season. Quest Diagnostics is the largest laboratory diagnostic laboratory in the United States. And they did a study looking at overall allergy sensitization rates. And they looked at total IgE, which is an allergy antibody associated with allergies, and showed over 4 years an increase in allergy sensitization. They delved down deeper into what was actually causing the increase in allergy sensitization. They found that ragweed and mold were two of the ones that were increasing over the 4-year period. So we know that mold has a role in the development of wheezing and asthma and rhinitis in children, at least from the ages of birth through age 13. Elevated total indoor mold in infant bedrooms were associated with increased odds of wheezing from birth to age 13. There was an increased levels of indoor mold predicting an increase of asthma development, and high concentrations of outdoor mold and bedroom floor mold and yeast predicted increased risk of allergic rhinitis development. This shows you an increase in our asthma prevalence over 3 decades. There's been a steady increase, which is associated also with the same increase in effect from climate change. And if you look at the right upper, there's a more current asthma prevalence also showing an increase in 2001 to 2009. This was a slide from the CDC showing percentage of persons who experienced an asthma episode within a 12-month period. And it shows an increase in all ages, but under 15, there was more of an increase. And over 15, there was a higher increase in girls and women. But in all ages, there was a significant increase in asthma episodes. So surveys were done on asthma prevalence by the National Health Interview Survey, also National Ambulatory Medical Care Survey, a National Hospital Discharge Survey, and mortality component of the National Vital Statistics System. And in this cartoon, you'll see that the asthma prevalence remains very high. The female versus male, other versus white, black versus white, and under 18 and greater than 18. And you will see that there's a very high incidence of outpatient physician office visits, emergency department visits, and hospitalizations, and even death. And there's obviously a larger effect on the Black population as seen in the middle of the slide, period. But all populations were affected and have an increased incident. So in summary, we find that there's a higher population of patients that are affected by climate change when there's a higher pollen count. And this is associated with increased allergic sensitivity, increased healthcare utilization, increased allergy of over-the-counter medication use, increased emergency department and physician office visits, and reduced lung function and increased pulmonary inflammation in asthmatics. There's also an increase in cardiovascular and respiratory mortality. And more importantly, there is an adverse synergistic effect with increases both in air pollution and pollen on asthma and allergies. As a practicing clinician in allergy, immunology, and pulmonary medicine, my patients are most vulnerable to the health effects of climate change. It will need public awareness, industry innovation, medical community leadership, and elected officials to work together to effect solutions to the health effects of climate change. Thank you.